A new breakthrough in the treatment of some forms of cancer. Dr. Chester Wilson of Desert Regional Medical Center in Palm Springs explains this isolates radioactive treatments to specific areas, which spares the surrounding tissue.
Traditionally, we treat cancer with three modalities. One is surgical oncology. Obviously, they cut the tumor out. Medical oncology gives chemotherapy, which is what's most commonly thought of by most people. And then there's radiation oncology, where we use radiation, much like surgery, to treat the local area. IMRT is the latest development in radiation therapy, and it's a way to target the dose of radiation therapy to conform to the tumor and spare normal structures. Here at the Comprehensive Cancer Center at Desert Regional Medical Center, since March of 2002, over 1,900 IMRT treatments have been delivered. We use IMRT treatments to treat prostate cancer primarily right now, and at the moment 100% of our prostate cancer patients who get external beam radiation are treated with IMRT. The machine is called a linear accelerator, and it's a machine that's about 9 feet tall and 15 feet long, and it looks very similar to an X-ray machine in the sense that there is a flat, hard surface or couch that people lie upon, and then at one end of the couch there's an arm that will rotate around them to deliver the radiation. Radiation affects all tissues. Radiation affects the DNA in tissues such that they can no longer reproduce. Obviously, there's DNA in our normal cells, so those too are affected, but they're affected to a lesser extent than the cancer cells. And the normal tissues can repair the damage to their DNA, but the cancer cells can't. There are always side effects whenever you undergo treatment for cancer. The side effects are decreased with the IMRT treatment that we use, but the side effects are limited to the area where the radiation is applied. So you can urinate more frequently. It may burn a little bit when the urine comes out, and you may move your bowels a little bit more, and the radiation may cause you to be a little bit fatigued. Course of treatment is typically in a curative situation 7 to 8 weeks, with coming every day Monday through Friday for approximately a 15-minute treatment. People would want to be treated with IMRT if it's applicable to their tumor type, because we can conform the dose of tumor just to the target, spare more normal tissue, which decreases the toxicity to the adjacent tissue, and we can also increase the dose of radiation therapy to the cancer, hopefully resulting in a better outcome. We are in the process of expanding the IMRT program to treat breast cancer, which of course mainly affects women, although there are a few men who get breast cancer. So we're looking forward to doing that for the women with breast cancer, and we hope that we will decrease the side effects to the adjacent tissue and make the side effects within the breast itself less. The general trend in radiation has been to better localize the delivery of the radiation to the target and spare normal structures adjacent to the target. And I think that 5 years from now, we will be better able to do that. The margin of normal tissue that previously has been treated has been relatively large, and that is decreasing. And I see that continuing to happen through a variety of technological advances.